Welcome back. This week we're going to talk about debunking the 5 myths associated with the first trimester of pregnancy. So, myth number one, sometimes I get practice members who come in and say that they've stopped their gym membership or they stopped their workouts because they found out that they're pregnant and that they're going to switch to prenatal yoga or Pilates or something a little bit more gentle, which is great. Nothing against prenatal yoga or Pilates or anything as such. However, we want to make sure that you are moving, especially as early as possible, so that we can set the foundation for the rest of our pregnancy. So, exercise is actually really safe and beneficial, unless, of course, it's contraindicated by your healthcare provider. So, this is not meant to be healthcare advice in that sense. But moderate activities like walking or swimming will really help to improve your circulation. It'll help to reduce the overall stress in our bodies and promote overall health, right? So there are 3 different types of stress that we look at. And one is physical structural stress. So many of us tend to be fairly sedentary in our day to day lives. So movement and exercise are really great. Ideally, I recommend that you actually try to get up and move and stretch at least once an hour to give yourself a little bit of a micro break throughout your day. It means changing your position. If you've been sitting, go ahead and stand up. If you've been standing, go ahead and sit down and take a little break. Myth number two is that you should eat for two right from the start, right? It can be really tempting because you're pregnant, you're excited, everybody tells you that, oh, you can eat all the things that you want. And it kind of goes into the cravings as well, right? So a lot of times we think that having cravings is normal, quote unquote normal. The caloric intake actually only increases slightly during first trimester, right? It's actually not a lot. It's about maybe 100 calories per day. And so we want to try to make sure that because the baby is still really small at that point, we still want to make sure that we're optimizing our digestion and our health. It is important what you're eating and then also how you digest it. And so it's not so much about eating for two, it's more about making sure that you can identify the macronutrients on your plate, right? Can you see that there's protein? Can you see that there's a complex carb ideally as opposed to a simple carb, so the fruit or vegetable, preferably the vegetable instead of the fruit, but in any case, having a complex carb instead of the grains and then some kind of good healthy fat along with that. So does your plate, your bowl, does your meal have those 3 components? That's what I would first aim for. And that ties into the third myth. So, myth number three is that your digestive health doesn't really play a significant role in your prenatal journey, right? If I talk about bowel movements all the time. So, if this is weird to you or gross to you, well, get ready because the babies poop and there's a lot with that. But when it comes to our digestive health, that's something that doesn't really get talked about very often, right? It's kind of this taboo topic. We don't talk about it with our friends typically. We don't talk about it even often with our practitioners unless it's pretty serious. And so what we get used to is the idea that, oh, I just have one bowel movement every few days or one bowel movement a day. That's just normal for me. Ideally, we want to make sure that you're having one bowel movement for every meal that you eat, right? So in first trimester, you're probably having maybe 3 meals in a day. And so we want to make sure that you're having one bowel movement ideally for every meal that you eat. If you're not, please reach out to me. I'd love to help you out because digestive health is a really, really strong passion of mine. Also, because when it comes to the prenatal journey, digestive health can really be a big factor in whether or not you experience postpartum depression and the postpartum part of your prenatal journey, right? So I'm not saying it's the end all be all, but having optimal digestion can significantly reduce, if not avoid altogether, the experience of postpartum depression, right? Because there's gut brain connection. We want to make sure that we're supporting your gut and your brain, but supporting that as early as possible. And then, speaking of the body, myth number four is that you're going to be destined to deal with back pain as some part of your prenatal experience. So, because the whole body is connected, right, through our nervous system, pain or any other symptom is really, in my opinion, just an indication that something is out of balance in the body. So, really, the only normal symptom of pregnancy is to gain about 25 to 30 pounds throughout your journey, which is going to lead to myth number five that morning sickness is normal in pregnancy, right? And that's kind of my soapbox topic, but I will say that it's very common, but it is not in fact normal, because if it's normal part of pregnancy, that means that everybody who is pregnant would experience that. But morning sickness is usually an indication that something, again, is out of balance in our bodies, but it can be more tied to how our body is handling different types of stress. And while pregnancy is fantastic and great, and you might be super excited, and it might be all the good things, but going back to the three types of stress, right? You might feel great, you might be moving, you might be eating well, but the body has to do a lot of things, especially in that first trimester, right? There's a lot of changes that are happening at a really, really fast pace. So the body has to keep up with all of that change in blood flow, all the nutrients that are getting distributed now between two outputs, right? As opposed to just going to your body. So the body is taking care of a lot of different chemical reactions, a lot of things happening. So we want to try to optimize our our nervous system health by going more into rest and relaxation, and having the fight or flight reserved for actual periods of actual stress, right? So we want to be able to maintain that flexibility and that fluidity going between those two phases, rather than getting stuck in fight or flight, or even we don't, always want to be in rest or relaxation, right? We want to be able to appropriately respond to that fight or flight when necessary. So if this is sounding interesting to you, I'd love for you to check out the course, the Move Well, Eat Well, Live Well course. We talk about this in a lot more detail. The link is below, and please join us next week for even more debunking of your prenatal journey. Thanks for joining us.